Assalamualaikum and good day, doctor. I'm Syahirah Binti Norin, a UI medical student. My metric number is BM23110034. For this self-study module assignment, I am going to talk about rheumatology. So what is rheumatology? Rheumatology is a medical specialty that focuses on the diagnosis and treatment of disorders related to the musculoskeletal system, particularly those involving joints, soft tissues, autoimmune conditions, and connective tissues. Moving on to the anatomy of that is involved in this specialty, the first one is the musculoskeletal system. It is a complex network of bones, muscles, tendons, ligaments, joints, and other connective tissues that provide structure, support, and movement to the human body. It is essential for maintaining posture, facilitating movement, protecting internal organs, and supporting the body's overall function. There are different types of bones, which are flat bone, irregular bone, sesamoid bone, long bone, and short bone. The second one is cartilage. So cartilage is a flexible and resilient connective tissue found in various parts of the body, providing structural support and facilitating movement at joints. It is composed of cells called chondrocytes embedded in the matrix of collagen fibers and a gel-like substance called ground substance. There are three different types of cartilage, which are elastic cartilage, hyaline cartilage, and fibrous cartilage. Each of these cartilage has different properties and locations. For example, we can find elastic cartilage in auricle of external air, hyaline cartilage in trachea and bronchi, and lastly, fibrous cartilage can be found in intervertebral discs. Last but not least is joint. It is a point of articulation or connection between two or more bones in the skeletal system. It plays a crucial role in enabling movement and providing mechanical support to the body. Joints are divided into two parts, which are solid joints and synovial joints. Solid joints have no synovial cavity and held together by connective tissue, and movements are more restricted compared to synovial joints. Solid joints are divided into two types, which are fibrous joint and cartilaginous joints. Meanwhile, synovial joints can be classified based on their respective articular surface and axis of movement. According to the shape of the articular surface, there are several types of synovial joints, which are plant joint, hinge joint, pivot joint, bicondylar joint, saddle joint, ball and socket joint, and ellipsoid joint. The next one is the physiology part, which is the muscle contraction. The muscle contraction begins when an action potential is initiated in the motor neuron. Acetylcholine released into the synaptic cleft. This will lead to the depolarization to spread along the sarcolemma and tubules. Calcium ions are released from the sarcoplasmic reticulum. Hence, sarcomere contraction is triggered, shortening the muscle fiber. The sliding filament theory took part afterward, as calcium ion bind to troponin and cause tropomyosin to move, exposing binding sites for the myosin heads. Energy from the splitting of the fresh ATP allows repositioning of the myosin head. Myosin heads bind to actin, forming cross bridge. Myosin heads rotate toward center of the sarcomere, which is known as power stroke. As myosin heads bind to ATP, the cross bridge detach from actin. The cycle will repeat again where ATP hydrolysis causes the myosin head to swivel and change orientation, releasing ADP and PI. The next one is the biochemistry part that is involved in this specialty, which is metabolism pathway, the degradation of purine. It is a biochemical process that involves the breakdown of purine nucleotides, which are adenine and guanine, into simpler compounds. The degradation of purines occurs through a series of enzymatic reactions, ultimately leading to the production of uric acid. The purine nucleotides are adenine monophosphate, AMP, and guanine monophosphate, GMP. The enzyme adenine phosphoribosyltransferase transferase, APRT, converts adenine to adenosine monophosphate, AMP, which is further broken down into inosine monophosphate, IMP. Guanine is converted to guanosine monophosphate, GMP, by hypoxanthine phosphoribosyltransferase transferase, HPRT. Both NMP and GMP are subsequently deaminated, leading to the formation of xanthine and lastly leading to the production of uric acid. For additional information, high production of uric acid might lead to gout. Moving on with the world-known rheumatologist, Dr. Paul Emery is a British rheumatologist who has made significant contributions to the understanding and treatment of inflammatory arthritis, particularly rheumatoid arthritis. He has been involved in clinical research and his work has contributed to advancement in the management of rheumatic diseases. Dr. Emery's clinical and research interests include rheumatoid arthritis, psoriatic arthritis, and other inflammatory joint diseases. He has been involved in studies related to disease mechanisms, novel treatments, and outcome in rheumatology. Dr. Emery has been associated with academic institutions and he held positions such as a professorship or leadership role in rheumatology department. Here are some common diseases and conditions within the field of rheumatology. The first one is rheumatoid arthritis. It is a chronic autoimmune disorder causing inflammation in the synovium, which is the lining of joint, leading to joint pain, swelling, and deformity. Secondly is osteoarthritis. It is a degenerative joint disease characterized by the breakdown of cartilage, resulting in pain, stiffness, and reduced joint mobility. The third one is gout. Gout is inflammatory arthritis caused by deposition of urate crystals in joints due to elevated levels of uric acid in the blood, which is a condition known as hyperuricemia, leading to sudden and severe pain, swelling, and inflammation. Last but not least is the systemic lupus erythematosus (SLE). It is an autoimmune disease affecting multiple organs and tissues, including joints, skin, kidneys, and the cardiovascular system. Rheumatologists use a variety of diagnostic tools and methods to assess and diagnose musculoskeletal and autoimmune conditions. Here are some common diagnostic tools used in rheumatology. The first one is radiological imaging that helps visualize the structure of joint and surrounding tissues. Common imaging studies include X-ray. It is a traditional radiography that is being used to assess joint damage and changes in bone structure. The second one is magnetic resonance imaging, MRI. It provides detailed image of soft tissues, joints, and inflammation. And the last one is ultrasound. It offers real-time imaging of joint and soft tissue, aiding in the assessment of synovitis, effusion, and erosion. The next one is laboratory tests, or known as blood tests. Blood tests are commonly used to detect markers of inflammation autoimmune activity. Common blood tests include autoantibody testing. This testing detects autoantibodies associated with autoimmune disease, such as rheumatoid factor and anticyclic citrullinated peptide antibodies. So the second one is inflammatory markers. Blood tests measuring markers like C-reactive protein and erythrocyte sedimentation rate help assess inflammation. Treatment in rheumatology aims to manage symptoms, reduce inflammation, prevent joint damage, and improve the overall quality of life for individuals with musculoskeletal and autoimmune conditions. The choice of treatment depends on the specific diagnosis, the severity of the condition, and individual patient factors. These are common treatments used in rheumatology: non-steroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, biologic response modifiers, Janus kinase inhibitors, immunosuppression, and through surgery. These are some resources and books that I used for this assignment. Thank you for your attention.